There's a number of different antigens which are currently being evaluated for multiple myeloma. This is a big field of research and has been spearheaded by advances in technology, predominantly through mass spectrometry, which has been able to find new proteins which serve as targets for multiple myeloma. Probably the most investigated targets are CD38 and BCMA. CD38 is an enzyme which sits on the surface of the myeloma cell, but is not restricted to myeloma cells. We find it in red cells, erythroid cells and striated muscle, but probably what's the most intriguing expression is on immunomodulatory cells, typically T regulatory cells and B regulatory cells. And we think that this is probably one of the key mechanisms by which CD38 antibodies mediate their effects. The second antigen is BCMA, also known as B-cell maturation antigen, and this is also a very high hubbub of activity in terms of CAR T cells, antibodies and antibody-drug conjugates. BCMA is a normal antigen. It sits on the surface of myeloma cells, but unlike CD38, is far more restricted in its expression. It's only expressed on late B cells and plasma cells, and this lends itself to being a very good target for treatment. BCMA naturally interacts with its ligand, known as APRIL, and when APRIL interacts with BCMA, it sets the plasma cell into cell cycle and proliferation. Interestingly, BCMA is cleaved at the surface by gamma secretase, and that forms soluble BCMA. So this becomes very interesting when you come to therapeutics, because we are using antibodies, antibody-drug conjugates and CARs to target BCMA. What we find is that soluble BCMA is a nice marker for activity. So if you treat a patient with BCMA-targeted CAR T cells, you see very rapid clearance in, say, their serum-free light chains or paraprotein, and we also see a reduction in their soluble BCMA. And also, interestingly, high levels of soluble BCMA confer an inferior prognosis for patients with multiple myeloma, so it can be used as a biomarker in a number of different ways. My final point about BCMA is to say that patient expression is quite variable, and this may potentially be a downfall, but gamma secretase inhibitors are now being developed, and this will increase the levels of BCMA expression, which I hope will attenuate or increase the results of the therapies that we see.